The coronavirus pandemic is devastating industries, businesses, and people's lives around the world. How bad will it get, and what has been done to fight the epidemic's economic fallout? And with the virus sweeping Europe, can a global leaders summit produce concrete actions to contain the pandemic? Welcome to The Point. Coming to you from Beijing, I'm Wang Guan, sitting in for Liu Xin. Europe is now the new epicenter of the coronavirus pandemic, with more than half of the confirmed global cases and over 60% of the global deaths. How are the Europeans coping? And what solutions will a global leaders summit of G20 offer? Joining me to discuss it all from Rome, Dr. Fabio Massimo Parenti, Associate Professor of International Political Economy at China Foreign Affairs University, and from Sevilla in southern Spain is Manuel Perez-Garcia, Associate Professor at Shanghai Jiao Tong University School of Humanities, and from Beijing, Feng Zhongping, Vice President of China Institutes of Contemporary International Relations. Dr. Parenti, I want to start with you. It is a war against insufficient medical resources in Italy, and perhaps more importantly, a war against time. We saw photos of nurses and doctors in Italy breaking down in tears in the wards and in their offices. What is the situation there like right now?
The situation is particularly dramatic, unfortunately. We have lots of deaths that are increasing day by day, and in some provinces in the north of Italy, the health system is collapsing, is under tough stress. So now we have new law day by day, new stricter measures to oblige as much as possible people to stay at home and to focus and channel all the resources to the most affected areas.
So with 5,000 or so cases added with each passing day, we still do not see the end of the tunnel over there in Italy, right?
Right, I think so. Statistics are weak because our ability to control the level of contagious is quite weak, even though it's improving. So we cannot trust completely numbers that we have, even though I can say that we have done better than in other countries in Europe that didn't pass for too long time and didn't look for the virus. And now the problem is exploding everywhere because of these delays and lack of coordination at European but also at national level.
But Dr. Parenti, we saw the extension of the nationwide lockdown in Italy. When do you expect the number of cases to peak in Italy?
Okay, our statistics give us the indication of the end of the month, of this month, to reach the peak, but we are not sure about it because it can happen that in other parts of Italy, as is partially happening, the level of contagious will is increasing at a faster pace. So there is this question mark about other regions. If the other regions will not get worse, probably at the end of this month, at the beginning of the next month, we can reach the peak according to the current numbers.
The turn of the month. Can we expect a peak in Italy? Hopefully that's the case. I want to shift gears and talk about Spain. Manuel, by Wednesday, Spain reported 3,400 deaths, and with that, it surpasses China as the second deadliest country from the coronavirus outbreak, only after Italy. So it must be a very difficult situation for you and your countrymen over there. What have you seen and heard?
Yeah, well, first of all, good night, Beijing, and good afternoon from Spain. Well, I mean, to be honest, now the situation is beyond to be dramatic. allow me a little bit to correct the figures you present, because they are today, they are even worse. The number of cases confirmed is more than 47,000. And people already dead, more than 3,500. And recovered people, more than 5,000. But the problem here is that it's really sad to say, but the Spanish government really took a long time to take action on this. And if you look at the Spanish geography, the virus and number of cases is very widespread in the whole geography, from north to south. Of course, Madrid, Barcelona, the Basque Country are the areas with more cases, but even south and east Spain is the cases are growing. And in contrast, as I said, in China the virus was more concentrated in the Hubei province, Wuhan, and all that area. In Italy is in the area of Lombardy, North Italy, but again, Spain is wide overspread. Surprisingly, Portugal, which is our neighbor, has a few number of cases. So probably that is, the most important thing is about the policies and the measure.
Why is it that the outbreak is so widespread all over Spain? Why is that the case?
Well, first of all, even in my own case, but talking about the people who have to make decisions, the government, we underestimate the problem. Let me tell you something. Late January, the first case in Spain was confirmed, and by that date, the Center of National Research in Spain, the so-called CSIC, advised to the government, please start to take measures, because this is going to be something really, really bad for the country, and the virus is coming up. So, but again, no measure was taken. All over February, the numbers of cases were growing. And again, another very irresponsible measure or non-action. 8 March, the demonstrations in Madrid. Thousands of people in Madrid, Barcelona, the big cities in Spain, in the street. And the following day, the government started to take measures. So this is something, again, really, really
certainly
bad.
That is not helping.
Also,
helpful to the containment and control of this outbreak. I want to turn to our colleague in Beijing, Professor Feng, looking at the trajectory of China's own outbreak, which is largely under control right now. When do you think the number of cases may peak in Spain and Italy, and what really must be done between now and then?
Yes, you say China, everybody knows, is the first major victim of this, disease. So we have been suffering in the past 2 months, and fortunately, due to the most effective containment measures, the cost people have been paid. So we all know have some experience of containing and this disease virus. According to our experience, 2 weeks. Of course, the situation are very complicated in different countries. But we must first, get everybody has been affected now, tested. This is only one way to do this. And then you put people in places which make sure that they are not going to affect others. So that is probably the second. Then you can count the days. So 2 weeks is probably the time people believe can be more or less we can know which is affected or not. So in that case, then
certainly we need a centralized isolation instead of a staying at home isolation, which is usually not very well enforced. Talking about working together, I want to talk about the role of the European Union. Dr. Parenti, the EU has been known as a community based on shared values, solidarity. Do you think these values have been largely missing during this outbreak?
Yes, absolutely. It's an historical trend. You know, now my point is that everything of the previous decades' mistakes is coming out, is manifesting itself. What I mean? Now, in terms of general paradigm, we have on one hand, the globalization with Western characteristics that is going towards what has been called the Munich recent security conference, Westlessness. On the other hand, we have the globalization with Chinese characteristics. Going to the paradigm, political economic paradigms, now we have neoliberal globalization, Friedman, Hayek, and so on, versus globalization with Chinese characteristics versus socialism, versus Marx and other thinkers in the socialist field. So what does it mean? That now, in this pandemic crisis, we are not showing solidarity. We talk about value, we talk and promote it as a paradigm of human rights, but Italy received, first of all and mainly, aids and supports from China firstly and mainly, and then from Russia, from Cuba, from Venezuela. Look, it's just the new geography of power at international level that confront two different paradigms, two different cultural background. On one hand, we have the domination of the capital interest, of aristocracy, of individualism, of intellectual property rights, if you want. On the other hand, you have a background, a cultural background of collectivism and solidarity, cooperation, and different way to deal with international relations. So everything is coming out, because also in Italy, our problem are not only the result of this dangerous virus that is stressing our system, are the result of 30 years of implementation of neoliberal policy, meaning taking away the state control over the economy and giving to the private hands too much public goods, too much public services. So we still have a quite good system, but strongly weakened by this dynamic. So now the reaction to this crisis just reflects these different paradigms and trends historically during the last decades.
Very interesting observation, Dr. Parenti. Manuel from Spain, I want to go to you. What are your reflections and thoughts on the role of the European Union in the midst of this pandemic?
Well, one of the most important things at the beginning, I mean, of course, there are two big crises, the medical, the sanitary crisis, which everybody is, many people is dying, and of course later, but not less important, is going to be the economic crisis. But at this moment, the most important thing is to contain the virus. Later we will take a look about the economic reform solution we have to put on the table, also the political reforms in terms of the European Union, but also in terms of national, the European members, like the case of Spain, because, you know, now with this instability in the local term in Spain, some people, some parties are seizing the opportunity to criticize and even to challenge our system, but that is not, it is not the moment and it is not the occasion. Now the most important thing, again, on the European level, national level, but even on the G20, because there's going to be a summit very soon, I would say, and my advice, it should be to look at what China has done to contain the virus. And that should be the road and policies we should take in the case of Spain and in other countries. Why I'm saying this? because the restrictions, the measures taken when this pandemic started in Wuhan were very strict, very rigid, but people follow the rules, and now you can see how the trend is downfalling. In the case of Spain also, I would say the prime thing and the most important thing, it should be for the case of Spain and the other European countries, is to send a delegation to China to ask for advice to the sanitary personnel and to people dealing with
the two sides
new
will
measures.
talk to each other, China and our European friends. I'm afraid that's all the time we have. Manuel, sorry to interrupt. Finally, I want to thank all of my guests: Manuel Perez-Garcia from Shanghai Jiao Tong University, Dr. Fabio Parenti in Italy, and last but not least, Feng Zhongping from China Institute of Contemporary International Relations. We'll take a short break. Stay with us.